November is National Diabetes Awareness Month, and more than 1 million people are diagnosed with diabetes each year. Joining us now is Dr. Michael Gonzalez. Good morning with Healthcare Partners. Thank you so much for being with us this morning.
You.
All month long, we've been talking about diabetes, but of course, this is something that affects people well beyond this month.
Yes.
There's two types, type 1 and type 2. What is the difference between those two?
Yes, thank you. The estimated prevalence of type 2 diabetes is around 12 to 40%, so around over 30 million people are affected in the United States. And 90% of what we see is what we call type 2 diabetes. It's a diabetes that develops because of weight gain and obesity, and it's characterized by deficiency of insulin and some degree of insulin resistance. And so what that means is that your body doesn't respond to insulin as well, and you don't make enough insulin. But the other 10% that we see is type 1 diabetes. And type 1 diabetes can occur at any age, but mostly at younger individuals. It's autoimmune in mechanism by which it comes out. So it's not brought about by weight gain. And this disease is characterized by absolute deficiency of insulin. And so these patients require insulin for the rest of their life just to get their sugars under control.
Every day. But there are some measures we can take, especially with type 2, correct, that will decrease our risk of getting diabetes. What are some of these things that we can be doing every day?
So I always tell my patients there are non-modifiable risk factors. Your family history, your heritage or ethnicity, you can't change that. But what you can change, things that you can modify, number one is your weight. You have to exercise at least 30 minutes every day, maintain an appropriate weight. You don't have to lose 100 pounds. If you can just lose 10 pounds every year, that decreases your risk for diabetes by as much as 7 to 10%. Stop smoking. Smoking actually has been shown to increase your risk for diabetes. Having a good lifestyle, maintaining a good diet, having balanced meals, don't eat too much carbs, and aside from that, having enough sleep. Actually, studies have shown that if you sleep less than 8 hours a day, if you don't get enough sleep, it increases your risk for diabetes as well.
Definitely. And let's talk about some of these symptoms. Some of the symptoms that can tell you if you may have diabetes or if you should go to your doctor and look into it.
Right. It's estimated, even though 30 million have diabetes, 1/3 of those have not been diagnosed properly. And symptoms of diabetes can be very, very vague. You can have unexplained weight loss, unexplained weight gain, blurring of vision. You can have frequent urination, frequent drinking, and also excessive thirst. And also, you can have blurring of your vision is a common symptom.
Definitely, and those things sometimes we don't realize could be connected to diabetes, but of course you want to go check in with your doctor if you feel like you have any of these symptoms.
If you have those symptoms, again, frequent urination, excessive drinking, unexplained weight gain, blurring of vision, unexplained fatigue, have your sugars tested. You can have an A1C test, which is a rapid test by which you can be diagnosed and screened for type 2 diabetes.
Perfect.
And even then, even if you don't have diabetes, but if you are what we call pre-diabetic, pre-diabetic means that your levels are not those of normal individuals, but not yet those of diabetics.
Definitely.
You're at higher risk than the normal individuals.
And there are things you can do every day. Of course, we want to remind you open enrollment for health insurance ends December 7th, so you can go to open enrollment TNV.com.
HCPNV.
Open enrollment NV.com. There we go. Thank you so much for coming by.